In this first part of Chapter 11, we are going to discuss agility and coordination and a few balance tests. The objectives of this chapter are to understand the difference between health-related and performance-related physical fitness, identify and define the components of performance-related fitness, evaluate and use available tests to measure agility, power, reaction time, speed, and other components, and to understand critical issues related to administering fitness tests. Performance-related fitness is defined as the fitness that consists of components that have a relationship with enhanced performance in sport and motor skills. This is also called skill-related fitness or motor fitness. Components of performance-related fitness include agility, balance, coordination, power, reaction time, and others. Health and performance-related fitness are closely related and often interchanged. People with performance-related fitness will likely have enhanced health-related fitness, and performance of most sport or motor tasks involves some components of health-related fitness, such as aerobic capacity, body composition, muscular strength and endurance, or flexibility. An interconnected example is the fitness role of power. Muscular power appears to decrease with age more quickly than muscular strength. Loss of power is associated with decreased functional ability and is a predictor for decreased mobility in older adults. What is power? Remember that the equation for power is the amount of work performed in a fixed amount of time. Next, we have agility. Agility is defined as the ability to rapidly change the position of the entire body in space with speed and accuracy. Agility is an advanced skill that is built on flexibility, strength, and power first, followed by coordination and balance. It requires flexibility, strength, power, speed, balance, and coordination, and involves those rapid change of direction and sudden stopping and starting. These activities should resemble the patient's activities that they need to be able to perform. Agility is highly task specific, and there is no valid measure of overall agility. Agility is also not highly correlated with health-related physical fitness, but it is more often correlated with performance-related fitness. Agility is task-specific, and task-specific measures of agility might be important as a measure of performance-related physical fitness. We have both upper extremity and lower extremity agility. When we think about sports, we usually think about lower extremity agility, that ability to change direction, cut. Think about a soccer player or a basketball player. However, upper extremity agility is also required for some specific tasks. When we think about sport, that might be a soccer goalie blocking a shot, or think about a piano player being able to change octaves or play a complex piece. We also have agility in its relationship with power. We know that balance has been shown to directly affect one's agility and performance. And we also know that adequate flexibility provides a base for speed and power. The greater the flexibility one has, the more power they are able to produce compared to somebody with restricted flexibility. We also know that the greater the power, the more quickly an athlete can move. Power is needed in order to be able to achieve agility. One can increase power by increasing the distance the body parts move. Agility and strength are also related. Patients with good strength can control the inertia that forceful movements create, and strength is a factor in maneuverability. So the stronger somebody is, they also have a greater likelihood of increased agility. To measure agility, we use agility tests, and these tests can predict potential differences in sports and activities, determine achievement, progress, and grades when agility is a specific objective, and evaluate the effectiveness of a specific unit of instruction in order to improve agility. There are some specific features to agility testing that we want to take into account. The first is surface area and type of footwear can have a significant impact on one's score. We also need considerable time in order to administer some of these tests to larger groups. Agility tests are often performance specific, and performance on one test may not predict performance in other sports or situations, and no test is the criterion measure of agility. Some of our common agility field tests are the SEMO agility test, the Illinois agility run test, as well as the shuttle run test. This is figure 11.1 in your textbook, and it shows you the SEMO agility test. This is to measure the general agility of the body in maneuvering forward, backwards, and sideways. And it's scored by taking the better of two trials and recording to the nearest tenth of a second. The next slide breaks this down with the specific instructions of this test. Here are the specific instructions in order to utilize this test, as well as the scores in relation to performance level. This is the Illinois agility run test, or it is in figure 11.2 in your textbook. This is another agility test, and it's used to measure the ability to change positions of the whole body and then run a weaving pattern. This one is scored using the time to complete each trial and is recorded in seconds. And the next slide will provide the specific instructions. Here are the instructions for the Illinois agility run test. This is our third example of an agility test. It's figure 11.3 in your textbook, and this is the shuttle run test. And this is used to measure speed and change of direction. And regarding scoring, the better of two trials is recorded to the nearest tenth of a second. The next slide will give the specifics. Here are the specific instructions for the shuttle run test. Another agility test that is common is the T-test. This test requires 4 different cones, and the procedure is that the subject starts at cone A. On the command of the timer, the subject sprints to cone B and touches the base of the cone with their right hand. Then they turn left and shuffle sideways to cone C, and also touch its base, this time with their left hand, and then they shuffle sideways to the right to cone D by touching the base with their right hand. Then they shuffle back to cone B and touch the base of the cone, and then run backwards to cone A. And the stopwatch is stopped as they pass cone A. Some things to note for scoring the T-test is that a trial will not be counted if the subject crosses one foot in front of the other during the shuffling component, if they fail to touch the base of the cone, or fail to face forward throughout the test. You want to take the best time of 3 successful trials to the nearest tenth of a second. And then we have the table here to show the scores for an adult for team sport athletes. The last agility test that we're going to talk about is the hexagon agility test. This is a test that requires athletic tape to mark a hexagon on the floor. The length of each side should be about 24 inches, and each angle should be approximately 120 degrees. And then the participant begins with feet together in the middle of the hexagon facing the front line. When the timer says go, they jump ahead across the line, then back over the same line into the middle, and then continue to face forward with their feet together and jump over the next side, and then back into the hexagon, continuing this pattern for 3 full revolutions, continuing to face forward throughout the test. This can be performed both clockwise and counterclockwise. For the scoring of this test, the athlete's score is the time taken to complete 3 full revolutions. The best score from 2 trials is recorded. Comparison of clockwise and counterclockwise directions will show if there are any imbalances between the left and the right movement skills. And then we've also got the scores here along with a video in the link. Next, we're going to talk about coordination. This is also known as motor coordination, but coordination is the ability to use different parts of the body smoothly and efficiently in a sequence that preserves posture. Several muscles are involved in a coordinated activity, and the components of coordination include perception of activity, feedback, performance adjustment, and repetition. Development of coordination involves a progression of activities from simple to more complex, as well as repetition. For coordination, some muscles are stimulated to provide an activity, while others are inhibited to permit the activity. Others are facilitated to provide synergistic or stabilizing responses to permit the desired motion to occur. Each muscle must provide an accurate response in both timing and intensity for the activity to be coordinated. If a muscle is too weak to provide the appropriate response, the activity will be uncoordinated and undesirable. For example, if a volleyball player does not have enough strength in their scapular rotators, the arm cannot be positioned correctly to hit and place the ball accurately. A soccer player who has weak hip abductors on the standing leg has neither the stability needed to stiffen the body nor the base needed for the opposite leg to kick the ball. For coordination, timing and intensity of muscle responses is important. If muscles are weak, they must work harder than they should in order to achieve a specific output. When a muscle lacks the strength to provide appropriate motion, it tries as hard as it can to perform the activity, and in so doing stimulates otherwise inactive muscles to assist. This causes incoordination. This result is undesired and inefficient and produces inefficient movements. The body's preference is for efficient, desirable movements. A patient must achieve adequate strength gains before you include advanced coordination activities. There are different levels of coordination. The progression of coordination starts with simple activities and moves to ones that are more complex. Increasing the speed of the activity, increases the force, or increasing the complexity are all ways to advance the difficulty of coordination exercises. All coordination activities require repetition if they are to be learned and executed accurately, and accuracy of performance is vital to the development of coordination. Some things that are important to remember is that once the patient begins to fatigue, coordination becomes less accurate. Continued execution of uncoordinated motions will include undesired movements in the engram. Remember, this is when you are scheduling coordination exercises or testing. The coordination activities should come early in the session when fatigue is less of a factor. There are several field tests to use in order to measure coordination. Some of the most common are the soda pop test, the alternate hand wall toss test, and the hair circuit test. The soda pop test is figure 11.6 in your textbook, and it is used to measure manual dexterity and hand-eye coordination. For scoring of this test, the better of two trials is recorded to the nearest tenth of a second. Here are the full instructions for the soda pop test as well as a video. The next test is the alternate hand wall toss test, and this is used to measure hand-eye coordination. For scoring, general ratings are from excellent to poor, and they're used for the wall toss test based on the score of the number of successful catches in a 30-second period. Here are the detailed instructions for this test, as well as the ratings and a video for your reference. The hair circuit test is used to assess participants' coordination abilities, the perception of themselves in space, and their dynamic total body coordination. Scoring for this test is the time employed to run the whole circuit is recorded to the nearest tenth of a second. The next two slides show the diagrams and the instructions for the hair circuit test as well as a video. We went over several balance tests in our last module. Your book also includes the BASTIC test and the Johnson modification for the BASTIC test, which I've included here for your reference. Here you can see the BASTIC test, and the next slide is that Johnson modification.